Welcome to today's story, The Curious Case of Cushing's Disease. A medical mystery about hormones gone wild, strange body changes, and one very stressed-out patient. This is Mr. Cushing. He noticed his clothes don't fit like they used to. His face is round like a full moon. His belly is getting bigger, while his arms and legs are getting thinner. And to make it worse, stretch marks started appearing on his skin. To find out what's happening, let's take a trip inside his body. Here we find the stress factory, a place that produces a hormone called cortisol. Normally, cortisol helps us wake up, fight stress, and control metabolism. But in Mr. Cushing, the factory is completely out of control. When cortisol goes too high, chaos begins. Fat builds up in the belly, face, and back. Muscles shrink, leaving arms and legs weak. Bones lose strength and break easily. The skin thins and develops purple stretch marks. Even mood and memory can be affected. Put it all together, and you get the classic appearance of Cushing's disease: moon face, buffalo hump, central obesity, thin limbs, and purple striae. These are the features that make doctors suspicious of the diagnosis. But that's not all. Cushing's syndrome comes with many symptoms: general appearance, moon face, buffalo hump, central obesity, thin arms and legs, and weight gain. Skin changes, purple stretch marks, thin skin, acne, easy bruising, and poor wound healing. Muscle skeletal, muscle weakness, osteoporosis, and in children, growth retardation. Metabolic, high blood pressure, high blood sugar, and high cholesterol. Psychiatric, depression, anxiety, irritability, and memory problems. Reproductive, menstrual problem, fertility, decreased libido, and in women, excess facial hair. And finally, frequent infections because the immune system is suppressed. Here's an easy way to remember it: big face, big belly, big back, but thin arms, thin legs, and thin skin. So what's causing all this? The culprit is a tiny gland at the base of the brain, the pituitary gland. In Cushing's disease, a small pituitary tumor orders the adrenal glands to keep making cortisol non-stop, even when the body doesn't need it. And now, the disease versus syndrome. Here's something important. When the pituitary is the source, we call it Cushing's disease. But when cortisol comes from somewhere else, such as an adrenal tumor or a lung tumor making ACTH, we call it Cushing's syndrome. Disease means pituitary. Syndrome means any cause. So, how do doctors confirm the diagnosis? They use detective tools. The dexamethasone suppression test shows if cortisol calms down. In Cushing's disease, it doesn't. A 24-hour urine test measures total cortisol, and MRI scans can reveal a pituitary tumor. So in Mr. Cushing's case, cortisol levels stay high even after dexamethasone. The urine test shows excess cortisol, and the MRI reveals a pituitary tumor. With these clues, the diagnosis is confirmed. And the treatment focuses on stopping the cortisol overload. Surgery to remove the pituitary tumor is the best option. If surgery isn't possible, medications can block cortisol production. Radiation can also be used in certain cases. After treatment, Mr. Cushing's stress factory finally calms down. Cortisol levels return to normal. His energy comes back, his body shape improves, and his life slowly returns to normal. Let's recap. Cushing's disease is caused by a pituitary tumor producing too much ACTH. That leads to excess cortisol, which causes fat redistribution, weak muscles, fragile bones, purple striae, and mood changes. Doctors diagnose it with suppression tests, urine cortisol, and MRI. Treatment is usually surgery, followed by medication or radiation if needed. And that's the story of Mr. Cushing and his overworked stress factory. Thanks for joining me in this medical mystery. If you enjoyed this, don't forget to like, share, and subscribe for more medical topics made simple.